Hassett's bold claim, "Get a job for health insurance, Trump tax bill and Medicaid cuts explained." Medicaid cuts threaten 7.8 million workers, employer insurance failures and rising health disparities. Healthcare crisis, Medicaid cuts threaten rural hospitals, urgent warning. Hassett's bold claim, "Get a job for health insurance, Trump tax bill and Medicaid cuts explained." The alarming truth about healthcare coverage cuts: a job is the best insurance. In a shocking revelation, National Economic Council Director Kevin Hassett has made a bold statement that has left many wondering: the best way to get insurance is to get a job. This assertion was made during a recent appearance on CBS News's Face the Nation, where Hassett discussed the massive tax cut legislation that has sent shockwaves through the healthcare system. A report that raises concerns. According to a report by the Congressional Budget Office, CBO, approximately 12 million Americans could lose Medicaid coverage due to the new legislation. This alarming figure has sparked widespread concern among healthcare advocates and experts. However, Hassett disputes this claim, citing a similar scenario in 2017 when the Trump administration attempted to add work requirements to Obamacare waivers. A surprising twist: work requirements lead to increased insurance. In 2017, the CBO predicted that the addition of work requirements would lead to a significant decrease in the number of insured individuals. However, Hassett claims that the opposite occurred. The number of insured people increased instead, he said. This surprising twist has left many questioning the CBO's predictions and Hassett's assertion that the best way to get insurance is to get a job. A new requirement: proving employment or education. The new legislation enacts a first-ever requirement for adults under the age of 65 to prove they work, volunteer, or attend school for at least 80 hours per month. Hassett believes that this requirement will lead to increased job creation and, subsequently, more people with insurance. The idea that that's going to cause a massive hemorrhaging in availability of insurance doesn't make a lot of sense to us, he said. A controversial claim: 5 million people have other insurance. Hassett also made a bold claim that 5 million of those who are losing insurance have other insurance options. He argues that these individuals will not be affected by the loss of Medicaid coverage because they have alternative insurance plans. They're people who have two types of insurance, he said. And so therefore, if they lose one, they're still insured. A reassuring message: no one will lose their insurance. Despite the CBO's predictions and concerns from healthcare advocates, Hassett insists that no one will lose their insurance. It's sound budgetary politics. And I think that nobody's going to lose their insurance, he said. However, this assertion has left many wondering if Hassett's optimism is misplaced. The verdict: a job is the best insurance? As the debate surrounding healthcare coverage cuts continues, one thing is clear: the future of healthcare is uncertain. Hassett's assertion that a job is the best insurance has sparked controversy and raised important questions about the relationship between employment and healthcare coverage. But here's where it gets interesting: will Hassett's prediction come true, or will the CBO's warnings prove to be accurate? Only time will tell. What do you think? Do you agree with Hassett's assertion that a job is the best insurance? Or do you believe that the CBO's predictions are more accurate? Share your thoughts in the comments below. Medicaid cuts threaten 7.8 million workers, employer insurance failures and rising health disparities. Low-wage workers face health crisis as Medicaid cuts threaten critical coverage. Imagine receiving a critical treatment only to face unpayable medical bills. For millions of working Americans living on the edge, this nightmare may soon become reality. A recent Congressional Budget Office analysis predicts that 7.8 million Americans could lose Medicaid coverage under a new policy package signed into law on July 4, 2025. In Michigan alone, this would displace 247,000 to 412,000 residents from the only healthcare safety net they've relied on. The heart of this crisis lies in proposed Medicaid work requirements, rules forcing participants to prove employment or face coverage loss. But here's the paradox: these requirements often push already employed individuals out of the program due to administrative hurdles rather than lack of work. Many of these workers would then fall into a coverage gap, ineligible for Affordable Care Act subsidies and unable to afford employer plans with sky-high premiums. Researchers warn this could trigger thousands of preventable deaths nationwide. Let's dissect the Michigan experience. A few years ago, the state planned to implement Medicaid work requirements costing $70 million in bureaucratic overhead. The courts blocked it, but if enacted, an estimated 100,000 residents would have lost coverage within a year. This mirrors Arkansas's disastrous 2018 experiment, where work requirements led to immediate coverage losses, not job gains. The reason? Many workers couldn't navigate the paperwork gauntlet required to keep their benefits. Why does employer-sponsored insurance fail low-wage workers? Nearly half of Americans rely on workplace plans, but these benefits cluster at the top. Managers/professionals *80% plus coverage. Blue-collar workers *50 to 70% coverage. The system's flaws run deep. 1. Legal exclusions * employers may impose 90-day waiting periods. 2. Cost barriers * low-wage workers often can't afford deductibles even when coverage is offered. 3. Fissured workforce * contractors and gig workers are frequently excluded from benefits. Medicaid has historically bridged this gap. Before the Affordable Care Act, low-income workers faced dire coverage shortages. Post-ACA, Medicaid expansion cut uninsured rates by 1/3 for blue-collar workers. For example, Michigan residents with Medicaid reported better health outcomes and financial stability, crucial for maintaining employment. Yet Medicaid isn't perfect. Providers face low reimbursement rates, and access varies by state. These challenges stem from underinvestment rather than systemic flaws. In contrast, employer-based insurance benefits heavily from tax breaks that disproportionately favor high earners, contributing to wage stagnation while leaving low-wage workers vulnerable. The debate boils down to this: is an employer-centric healthcare system sustainable when it leaves millions behind? Critics argue a public, universal model could reduce administrative costs and ensure continuous coverage. While politically contentious, Medicaid's evolution, from welfare program to essential safety net, proves its adaptability. The current crisis may be the wake-up call needed to rethink how we protect workers' health. October 4, 2025, this article reflects President Trump's signing of the domestic policy package into law, which includes sweeping Medicaid spending reductions. The stakes for working-class Americans have never been higher. Healthcare crisis: Medicaid cuts threaten rural hospitals. Urgent warning. Brace yourselves, a storm is brewing in the healthcare landscape. Over the past few decades, our region has witnessed a significant consolidation of hospitals. Hazleton, which once had 2 local hospitals, saw them merge and eventually join the Lehigh Valley healthcare system. Similarly, Wyoming Valley, which had numerous medical centers, now primarily relies on 2 major players, Geisinger and Commonwealth Health. This trend of merging into larger entities shows no signs of slowing down. Geisinger, for instance, became part of the Kaiser Permanente network through Risen a few years ago. Meanwhile, Commonwealth Health continues to grapple with maintaining regional facilities and meeting the community's service demands. In a 2023 editorial, we highlighted these rapid and often abrupt changes, such as the sudden closure of First Hospital in Kingston and the merger with Highmark Health, which overshadowed the once prominent Blue Cross of Northeast PA. The healthcare landscape is evolving at breakneck speed, driven by advancements in telehealth, new drug developments, and innovations like AI and robotics. These technologies are transforming how we access and experience healthcare. While we praised our region's legislators, healthcare leaders, and educators for adapting to these changes, a new threat looms on the horizon. The recently passed One Big Beautiful Bill might sound harmless, but its proposed steep cuts to Medicaid pose serious risks. Many hospitals, especially in rural areas, rely heavily on Medicaid reimbursements to stay afloat. Even before the bill became law, a rural health clinic in Nebraska announced its impending closure, citing the anticipated Medicaid cuts as a contributing factor. An analysis suggests that over 300 hospitals nationwide could face similar risks. But here's where it gets controversial: the cuts appear to be driven more by ideology than practical reality. If the cuts were sensible, why would Republicans need to allocate $50 billion to support rural hospitals? Additionally, Alaskan Senator Lisa Murkowski's vote flip-flop, from no to yes after her state was exempted from the cuts, raises eyebrows. She even criticized the bill, stating it wasn't good enough for the rest of the nation. Regardless of your stance on this legislation, it's now law, and we hope it delivers on its promises. However, it's not irreversible. We urge lawmakers to monitor the impact of Medicaid cuts closely. If hospital access declines as feared, we hope they will prioritize the well-being of their constituents over party lines and pass corrective legislation. And this is the part most people miss: healthcare isn't just about politics, it's about people's lives. So, let's ask the tough questions. Do you think the Medicaid cuts are justified? How should lawmakers balance ideology with the real-world needs of their communities? Share your thoughts in the comments, we'd love to hear your perspective.